Rescue breathing is a type of first aid that's given to people who have stopped breathing. During rescue breathing, you blow air into a person's mouth to supply them with the vital oxygen. Hello everyone, my name is Janela Adria M. Parva. I'm from Caregiver course. For today's video, I'm going to demonstrate how to do a rescue breathing for an adult. If you encounter someone who is unresponsive and isn't breathing, call 911. If you're in a group, ask another person to call while you proceed to the next step. Check for the carotid pulse. Use the flat parts of your index and middle fingers and press with moderate force in that valve. Time to tilt the head of the patient and put the index and middle finger. Spend no more than 10 seconds looking for a pulse. Look one more time for signs the patient is breathing normally. If you determine at this point that the child is unresponsive, not breathing normally, but does have a pulse, continue immediately with rescue breathing. Grab the rescue mask and seal it over the victim's face and nose. Lift the victim's chin and tilt his or her head back slightly. Breathe into the mask and count out loud. 1, 1002, 1003, 1004. Continue using the rescue breathing technique until help arrives or the patient revives. If you have an AED, consider preparing it for use just in case the patient loses her or his pulse. As always, the first thing you want to do is make sure the scene is safe and that your gloves are on. And make sure you have your rescue mask, one-way bag handy and begin calling out to the victim to assess whether or not he or she is responsive. Sir, are you okay? Hey child, are you okay? Hey, are you okay? If you don't get an initial response, place your hand on the child's forehead and tap on his or her collarbone. If you still do not get a response, proceed with the following steps. Check for the carotid pulse located between the trachea and sternocleidomastoid muscle. In the valley between these two structures, use the flat parts of your index and middle fingers and press with moderate force in that valley. Spend no more than 10 seconds for looking for a pulse. Look one more time for signs the patient is breathing normally. Grab an appropriately sized rescue mask and seal it over the child's face and nose. Lift the victim's chin and tilt his head or her head back slightly. Just pass perpendicular. If his place, my gloves are on. A rescue mask is already here. You call 911 and activate EMS. And call a code if you're in a healthcare setting. Hey child, are you okay? Hey child, are you okay? Going to check the pulse. I can easily feel the pulse, but the breathing is not normal. Going to proceed to the rescue breathing. 1, 1002, 1003, 1004. 1, 1002, 1003, 1004. 1, 1002, 1003, 1004. The pulse is normal. I can easily feel the pulse, but the breathing is not normal. I'm going to do again a rescue breathing. One breath for 3 seconds. I'll do this for 2 minutes. And I'm going to continue this until the emergency medical arrives. But if the pulse is gone and the breathing is gone, Proceed to the CPR procedure and wait until the emergency medical arrives. Hi, my name is Chanel Andrea M. Parba. I'm from Caregiver Course. For today's video, I'm going to demo how to do a rescue breathing for an infant. As always, the first thing you want to do is make sure the scene is safe and that your gloves are on. Make sure you have your infant-sized rescue mask with the one-way bulb handy and begin calling out to the infant to assess whether or not he or she is responsive. Hey, hey, are you okay? Baby, are you okay? Hey, hey, are you okay? If you don't get an initial response and you can see that the infant still isn't breathing normally, place your hand on his forehead and tap the bottom of the baby's feet, shoulder, or rub their belly. Check for a pulse using the brachial artery, located on the inside of the arm between the bicep and tricep against the humerus bone. Use the flat parts of your index and middle fingers and press on that artery. Spend no more than 10 seconds looking for a pulse. If you determine at this point that the infant is unresponsive, not breathing normally, but does have a pulse above 60 beats per minute, continue immediately with rescue breathing. Grab a small size rescue mask and seal it over the infant's face and nose. Place something firm under the infant's shoulders, if possible, to lengthen the neck a little and create a neutral or slightly sniffing head position. Hey baby, are you okay? Hey baby, are you okay? Call 911 and activate EMS or call in a code if you're in healthcare setting. I'm going to check his pulse. I can feel the pulse, but the baby's not breathing. I'm going to do this again for 2 minutes and check for the pulse. The pulse is the pulse is still present, but the baby is not breathing. I'm still going to continue the rescue breathing. One breath for 3 seconds for another 2 minutes. Check the pulse. The pulse is gone and the baby is not breathing. I'm going to proceed to the CPR until the emergency will arrive.